Today we are connected to the Indonesian G20 Presidency's health spokesperson, our very own Ibu Siti Nadia Tarmizi. Good morning, Ibu. Thank you so much once again to join us right here on the C Morning Show.
Good morning.
And Ibu, as we're...
Good morning, Karen.
Thank you, Ibu. Good morning to you too. So, we've already seen the data and also the statistics. And, first of all, with the cases showing an upward trend, how's Indonesia's, COVID-19 situation as about right now? And what about the implementation of the booster shot as a mandate for those that is going to travel, especially, across Indonesia, Ibu?
Yeah. As we are aware, if there is a new subvariants, and we knew that firstly, like England, Europe, and US, they found the BA4 and BA5, and mostly because of those two variants, the number of COVID-19 keep increasing, and we know that currently in many other countries the number is growing up because of these two variants, and even like in India they found BA2 7.5 as a new variant. So as we already noticed, because of subvariants, and we already found these two variants in Indonesia too. So we already expect there will be like increasing number of COVID-19, and we predict previously it will be going up, and it will be have the peak on the third or fourth week of July. But we still look how we mitigate, so the increasing of the COVID-19 cases is not expect out of our assume.
All right, we talked about the numbers that have gone up. They actually started going up, recorded anyway, around July the 2nd. We had 1,794 cases, and since then, the numbers have only continued to go up. We're over 4,000 right now. So I guess my question is, when does a country like ours declare a new wave? For example, when would we be entering a fourth wave? Do we actually declare that on a specific number, or do we look at the trend, or do we look at hospitalizations? What are the basis of declaring a new wave?
Yeah, the first thing is the number. It will be almost as high as the previous wave.
Okay.
So we see that we have like 60 thousand on the third wave. So we keep looking how the highest number on the new potential wave. Yeah, so we call it something like that. And secondly, we see the trend. If we look, of course, starting July, there is an increasing number, but again, we try to look at the number of that case, and the number of that being hospitalized. It's still the number. Although there is an increasing the number of those two groups, but it's still manageable. So it's still under the indicator. So it's still in the safety. I think it's safety range. Yeah.
Ibu, I have a quick follow-up question. Why is it that in some other countries, they're seeing a rise in positive cases, but also a rise in a lot higher hospitalizations? For example, we just reported earlier in Australia in our first segment, their numbers are going up because of winter. However, their hospitalizations have gone up quite significantly, putting a lot of stress on their healthcare system. Why is that different in a country like ours, where we get more positive cases, but the hospitalizations and fatalities continue to stay quite low? Does it have to do with vaccinations or something else?
Yeah, we did not really know how the virus, the COVID-19 works. Yeah, but at least what we found in Indonesia, we have two immunity. The first one is the individual immunity that quite high, because the coverage of our vaccination is now almost. 62% of the total population got the vaccination. And the second one is in terms of immunity at the community level is quite high too. We found from the our seroprevalence surface is at the community level like 96% of the population have a highest antibody titer. So that with
Right.
those two things, we are able to manage this virus. So we found that there is a number that confirmed cases are increasing, but it's very mild symptom, or even
Correct.
they don't have the symptoms at all.
Right.
So
Yeah.
with those two conditions, I think is two things that contribute. And the second thing is we never really have a health protocol release for the policy. Yeah.
Right.
So we
We've
still
always had
have
them in place.
wearing masks. Yeah.
Yes.
So although at those time we have a very low number, but the protocol, the health protocol still implement and still encourage to be implement in either outdoor, for example, like wearing mask still in outdoor and indoor
Yeah,
activities.
I noticed as
Right.
well, like Indonesians, we tend to, even though we were allowed to take off masks outdoors,
Right.
like when you go outside, a lot of people are still, majority of
Right.
people I would say are still wearing their masks. I guess it's out of habit as well, right?
But even though right now, because of the economic reasoning that everything is opening up, businesses are opening up and whatnot, and because of this news of variant, but I always think that Indonesia is always, Ibu Siti Nadia, I mean, kudos to Indonesia, because everywhere I go around the world, or, friends that we talk to, from every parts of the world, they always praise us Indonesia and how we encounter the COVID-19. Ibu, me and Paul and myself, we do have friends that is in Jakarta that got infected, but their recovery seems, is very fast-paced and
Short,
whatnot.
yeah.
So they got it, but within a couple of days, they got recovered, and we know that's because of the vaccination, and they said it themselves. If we didn't get vaccinated, maybe it's going to be much more worse than that. So again, this is due to the government, you and your team, Ibu Siti Nadia, how you encourage the public to always follow the health protocols diligently and now get boosters. So what other steps have the government taken to respond to the rising cases, Ibu Siti Nadia?
Yeah, again, when we have homecoming for Idul Fitri,
Yeah.
remember that at that time the government implement the policy that every travelers need to be a booster shot before they travel. Now we see there is a potential increasing the number, and then the number that got the third vaccination is still like 50 million out of 180 million. So that's why, again, in order to manage the increasing of the number, once again, government are put a booster as one of the condition to be used by traveler, either by sea, land, or by air. And the second one is, again, we encourage people to keep using the wearing mask
Yeah.
whether
Correct.
they are doing activity outdoor, but which previously we already lifted about wearing mask in outdoor activities. But currently, again, we stressing, like our president Pak Jokowi said, that we still need to keep using
Yes.
a mask, whether it is indoor or outdoor activities.
Yeah, we have to see how the climate is, right?
Of
Because
course.
some people would say, why keep it changing? Now
Yeah.
you said you can, open your mask, but now you have to put it on again. But we see the climate. When it's like uprising, we know for sure
Yeah.
that mandatory like health protocols, we know it should be done properly again.
Yeah, and outdoor events are taking place a lot more now. For example,
Yes.
concerts or Jakarta
Correct.
fairs. So if you are outdoors, but there's a lot of people around
Sports.
it would be a lot smarter. Yeah,
Yes.
especially these major sporting events. So speaking of boosters, Ibu, we talked about how we have actually hoped that more people would have got their boosters, which is why the government is putting incentives right now for travel. If you have gotten your boosters, then you don't need to be tested. But we're still lagging a bit behind in regards to these third shots. So knowing this situation right now, what are the plans going forward for those that have already got their third booster shots but are starting to have that term come to an end? For example, almost 6 months ago, or just about 6 months ago, that they would be in line for their fourth booster shot. What is the plans right now for the fourth shot?
Yeah, I think firstly we need to keep increasing the highest immunity at individual and at the community level. That's why the government put the policy to have a booster, yeah, to increase the coverage of the third vaccination.
Mm-hmm.
While we are waiting, in fact, of WHO recommendation and many international experts whether we do need the fourth vaccination. Yeah,
Mm-hmm.
and the second one we are waiting for our second survey regarding the sero survey because like you mentioned, like Paul mentioned, that there some people already have vaccination more than 6 months ago. So we would like to see whether this survey showing very decreasing number of our titer antibodies. So it might be one of the national expert on immunization consider whether we need to have fourth booster. The other thing, if we see the first group that receive injection is on the health worker. Yeah,
Mm-hmm.
while we seen there is not much trend number of the health worker get infected currently. So that's why we don't really think that the fourth booster is one of the priority to mitigate the situation currently. But mostly. Of course, again, strengthening the health protocol, and second one is to get a booster, and then again, you need to have tested if you not meet the criteria.
Yeah, and
Correct.
that would make sense because we need to get all the others caught up first
Mm-hmm.
before we
Of
give
course.
more advanced boosters for those,
Right.
because otherwise there'd be too large of a gap between,
Correct.
there'd be basically two separate communities,
Right,
right?
and I think we are really on the board for everyone to get boosted right now, and that's the internal affairs or internal issues right now, Ibu Siti. As we know, we're already opening borders. There's a lot of people coming in. I remember when I went back to States on December, one of the mandate of coming back to Indonesia, you need to have to take your PCR test and to show negative results. I just came back 3 days ago, Ibu, and then from the Los Angeles International Airport, they just asked for your boosted vaccination. If you got it, then you can fly without any PCR. So, with this, especially coming with the G20 summit, Ibu, in November, there's a lot of agendas and also meetings following up before that. What are the preventive measures the government has drawn up in regards of those events and agendas and meetings?
Yeah, this one thing that we quite confirm. Yeah, this BA4 or BA5 or another subvariant or a number that are now increasing is not really. Need to be worried, yeah, because currently with all the lifted of the many activities in terms of social activities or the community activities or even like you mentioned,
Mm-hmm.
there is many travelers come to Indonesia. So we did not see really a trend, rapidly a number of new cases. So that's why we quite secure, although there is a number COVID-19, which are currently
Yeah.
increasing, but still we need to alert, of course, yeah,
Yes.
because we don't want, although this new variants is very less symptom and very less number that need to be hospitalized, but if the number quite high, it will
Mm-hmm.
be affect to the being to be hospitalized. So those things that we try really to prevent in terms of you need again, if you have symptoms, you need to again to get tested, because
Yeah.
currently, Carol, many people doesn't want to have tested because
Correct.
if they got tested and then they got positive, they cannot go anywhere because
Correct.
they
Right.
Peduli Lindungi will be changed. So that's
Yes.
something that you need to keep. You need to be tested, although you have symptoms like sneezing or coughing or even
Yes.
very light fevers. And
Right.
secondly, you need to be isolation. So those things need to be understand from the community side that they need to do that in terms of we alert for the new number. And again, for the G20 situation, we don't have quarantine policy currently. Like you mentioned, Carol, we just need the third booster. And then
Yes.
while we are having the meeting, of course, the test every day for antigen and PCR keep done for all the delegates in
Yeah.
terms of prevent. And again, the number is still limited.
Yeah, you know what? I just would like to add on to this, if you don't mind, also, Paul. When I was in the airport, someone who's in the same, who wants to travel back to Indonesia just as me, I think he only got the second vaccination. He's not boosted yet, Ibu, but he took a PCR test.
Right there on
But
the
the
spot.
people in the airport said you cannot board the plane because this is mandatory
At
for
all.
Indonesia. From the government of Indonesia, you
Really?
need to have your booster shot, or you cannot be accepted to
So
the
the
country.
only option was for this person to get a shot
Yes.
first, and then
Right. So it was very imminent, and they're following the protocols from the Indonesian government. So if you're not boosted, you cannot arrive. You
Right.
cannot fly to the country
And
itself.
probably this person didn't know at the time because they had probably been over there for quite some time, and then the rules changed while they
Right.
were away, and then while they tried to
Yeah.
come back, they were following the old
Yeah,
rules.
we're just saying that our government is just very very diligent with the
Yeah.
mandates and the regulations
And I
for
think it-
people coming into Indonesia.
So it's up to us as well as travelers to always stay updated as
Of
to
course.
what the rules are at this point because we never know, right?
And subject to change, right?
Exactly,
Yes.
exactly. Anyway, Ibu, thank you so much for your time this morning. We do appreciate all the latest updates. It's always great to check in with you.
Yes,
and
Ibu.
we hope that you're always staying healthy out there. Big G20 coming up.
Yes. Thank you, Ibu. A very good
Thank
morning
you.
to you.
Take care.
Happy Monday.
Yeah.
All right.